But I want to go back in time to the 7th of March 2022. And many of you in the room in Teach to Reach 8 today in our Zoom studio know that that was the date, the 7th of March 2022, when you joined the movement for Immunization Agenda 2030. Now, this was a 4-month learning cycle in which you worked intensively together to do a number of things, starting by sharing ideas and practices and figuring out what the ideas and practices of others meant to you, moving on to situation analysis, diagnosing the root cause of an immunization challenge that you face where you work, in your facility, in your district, in your region, in your country if you work at the national level. Moving on to then identifying corrective actions. This was in May 2022. Over 1,000 members of the movement for IA 2030 developed action plans. These action plans were finalized on the 17th of June 2022 at Teach to Reach 6, and we're now more than 1 year later. And we're going to hear in this next segment what have leaders of the movement done in implementing. How has it turned out? Has it actually made a difference? These are the kinds of questions that we want to explore now in this segment. Before we do, we're pleased to share the first 3 IA 2030 movement implementation case studies, and you're going to see 3 faces of leaders that you may or may not know, starting with Wesnam from Senegal. Wesnam, a midwife in Senegal, was shipped off to run a health post in rural Senegal with little experience of immunization and country backup. And she says it was a colleague, a fellow scholar, fellow leader of the movement for IA 2030, who showed her how to keep an immunization registry, who showed her the basics of running her facility. With the support of that scholar and other leaders, she's been able to take the Penta 3 coverage from 8% when she arrived to more than 80%. Think about it. And she says that many of the ideas that she used came from the movement and from Teach to Reach. For example, she introduced vaccine angels as community liaison points, so peer educators, caregivers who function as peer educators. And that idea she first heard at Teach to Reach. Second leader is Frank Monga, District Medical Officer in Lumumbashi. Now, he's been participating in the TGLF network, and he introduced a token scheme to catch up on zero-dose children in the DRC. And he was selected in July 2019 to lead the national network in the country. And this network has grown to the point where the Ministry of Health, the national planners, attend the meetings led by Frank and his peers because it is an incredibly useful way to get information from all over the country. Think about it. These are achievements of leaders of the movement for Immunization Agenda 2030. Our movement is global. And so the third case study is Maria Fernanda Manzan, who runs a primary healthcare center in Corrientes, Argentina. And she's focused on enhancing coverage in a nearby slum area where the population is not motivated to seek immunization services. These 3 case studies are available now. We've shared the links with all Teach to Reach participants. Go. You may be inspired. You may find useful ideas and practices that you can use in your implementation. We're now going to turn to some of the implementers, some of the leaders of IA 2030 who've been working for more than a year now on implementing their action plans. We've recently asked them to share an acceleration report, what we call acceleration to impact, in which we asked them to update us on how their implementation is going. Charlotte, I hear an open microphone, so I'm guessing you already have the first IA 2030 leader ready to speak.
Yes, Reda, we have Kingsley Ninyere that is here. So, Kingsley, warm welcome to you, and please do start by introducing yourself.
Thank you very much for the opportunity. I'm Kingsley Ninyere. Hello? Yeah, I'm Kingsley Kofiningere, working with Community Youth Development Foundation in Ghana. Yeah, with regards to my situation analysis or my action plan, my challenge was negative attitude towards COVID-19 and malaria vaccine. And in fact, relating to this problem that I had in my district, which is negative attitude towards COVID-19 and malaria vaccine. The community were of view that this newly introduced vaccine was introduced to render them impotent. And being someone who wants to bring behavioral change communication, I embark on what we call community sensitization. I collaborate with the municipal management team and then the vaccination team. While we are doing the sensitization, the volunteers too are also doing the vaccination along the side. And it will interest you to know that a community that was identified in the Nkranza North district saying they are COVID-19 vaccine hesitants. Per our sensitization, in fact, we were able to vaccinate more than 50 people within a day. And I think that was a plus that very day. Coupled with the malaria vaccine, which was also a challenge, the Ministry of Health has developed an intervention and they've introduced malaria vaccine, which is the RTSS, solely for children under 5. That is to say 6 months, 7 months, 8 months, 9 months, and then 2 years. And being being someone who wants to bring about who wants to bring about behavioral change communication, that intervention has served as a catalyst to me. And then I have to make sure that I do more and more of the sensitization at the house to house, one-on-one, and then community information centers. And by so doing, people now are now freely going to the vaccinating centers to vaccinate their children. And I think for now, I've also interviewed about 7 districts, sub-districts within the municipality, of which the disease control officers that are in charge confirmed to me that, in fact, with regards to the RTAS, that is a malaria vaccine, it has it uppers. That is to say, the number has increased more than they used to have for the previous years. And I think it's also a plus. So with regards to my action plan, in fact, it has yielded the fruitful results in the Kintampo municipality with regards to the malaria vaccine and that of the COVID-19 vaccine.
I,
Another
Kingsley,
one
sorry to
has to
interrupt, but I'm not sure I understand. Can I ask you a few questions because I don't understand? So, it was your IA 2030 action plan focused on COVID-19 vaccine or on malaria vaccine?
it was both. That is COVID-19 vaccine and the malaria.
Okay, yeah, yeah. And so, what has changed through the work that you have done? What is different now compared to a year ago? Better is there better acceptance?
The challenge was negative. Hello, come on.
Yes, go ahead.
Yes, my challenge was negative attitude towards COVID-19 and malaria vaccine, and that is what I embarked on the sensitization with regards to these 2 vaccines.
Okay, very interesting. So from the outset, you decided to take an integrated approach, combining just linking COVID-19 and malaria. And so, what is different in terms of attitudes and behaviors of the community? How do you know? And what is different in terms of vaccine coverage?
With regards to malaria, before the action plan was developed, I have a chance to meet with the 7 sub-district of the disease control officers to inquire from them how is was the malaria vaccine coverage with regards to their various sub-districts. And in fact, the performance by then was very low. So per my sensitization and also the intervention that the Ministry of Health has brought on board by seeing that children under 5 who goes for immunization, or CWC, that's a child welfare clinic, should be immunized against malaria. And that one, when I went back again to interview the disease control officers for the various 7 districts, they confirmed to me and they will show me the records. And I can see that there is much improvement as compared to 2021. And then with regards to the COVID-19 too, by then the coverage was 40% in the Kintampo municipality. So my organization, which is a Community Youth Development Foundation, who is carrying out community sensitization, has to collaborate with the Ghana Health Services as well as the COVID-19 vaccinators. So we do house-to-house sensitization alongside with the vaccinators. So whosoever we are able to convince by our sensitization, then the vaccinators will also vaccinate the person that very time without any hesitancy. So I think there has been much improvement with regards to the 2 vaccines that was my challenge in the Kintampo municipality.
Thank you, Kingsley Ninyere from Ghana. Thank you for helping me understand. Now, the question is: so you joined the Movement for Immunization Agenda on the 7th of March, 2022. You participated in many of the intense learning activities. How did that actually help you with this, with your action plan? What did you gain by participating in the activities, sharing your experiences with your colleagues, listening and learning to the experiences of others, sharing your own experiences, doing root cause analysis, doing mapping out corrective actions? What difference did that make for you, if any?
With regards to
Oh, I think we lost you, Kingsley. Yeah, please go ahead.
by then, to even select, I hope you can hear me now.
Yes, you're back. Yep.
Yes, to even select my title or my challenge was not easy to come by, but the idea engine has helped me to identify my main challenge within the district. And then with regards to the idea engine, it has also made me to get my key area of focus. And that key area of focus was what I actually used to carry out my sensitization. And then how to even identify some of the stakeholders within the community to carry out the sensitization activity, it wasn't easy. So this, as I gained the movement, it has helped me to identify some of the key stakeholders within the community so that I collaborate with them to do the mobilization. And then when I get there, I'm able to do the sensitization. Notwithstanding that, it has also helped me to identify some of the community health volunteers within the various selected communities that are intended in my project. So those volunteers also assisted me in doing the mobilization. Mothers, they have helped me. And during the peer review of others, during the situation analysis.
All right, I think you're coming in and out. We've lost you, Kingsley, but thank you for sharing. I think we understand.
During the review, it has given out my plan, and which has helped me. Thank you very much.
Thank you very much indeed. We're talking about what movement leaders are doing with their Immunization Agenda 2030 action plans, what they're actually implementing and what difference it's making, how being part of this global peer learning network through Teach to Reach, through various activities of the Movement for Immunization Agenda 2030 can actually help you do better, work faster and better in a connected way, getting inputs, ideas, practices from all over the world in order to figure out which ones you need will actually be helpful to you where you are with respect to your immunization challenge. So that is what we're doing now. Let's go have a look on social media and let's see. All right. Oh, okay. There's a lot there. We're not going to be able to do everything. Charlotte, is there one more IA 2030 implementer that we're going to hear from? Charlotte, you're muted. Is
Oh,
there
sorry,
what?
Reda. I see Castro Bong. His hand is raised. I know he's a long time member of the movement for IA 2030. I'm inviting Castro to unmute.
All right.
Castro, are you able to? Let me see if I allow him to speak.
All right, we've only got 12 minutes left, and then we have a special focus on Nigeria, and we'll tell you more about it and the Zero Dose Learning Hub in the final minutes of this segment to show you where to go. It's not going to happen here in the plenary or in the stage. It's going to happen in the sessions. So I'm going to show you that in a few minutes. Special focus on Nigeria. Welcome to you, Castro Fogembong. Please introduce yourself. Tell us who you are, where you work, when you joined the movement for IA 2030, and then we'll ask you about your action plan.
Good afternoon. This is Castro from Ghana, working in the Lambusie District Health Administration in the Upper West Region, Disease Control Officer.
All right.
Can
So,
you hear me?
yes, loud and clear, Castro. So, when did you join the movement for IA 2030?
I joined the movement IA 2030 in March 2022.
And what was the challenge, the immunization challenge that you decided to take on?
My immunization challenge was access and then utilization. We have low access coverage in terms of antigen, always below 90%. And most of my sub-district, not all, at the end of the year usually have low utilization, more traveling out. So my action plan was to take some corrective measures and work towards to achieve the coverage. Comparatively,
So,
we have
wait,
taken
before
so
you tell
far
us
some corrective measures.
before you tell us about your
Hello?
action plan, yes, what was the root cause of your challenge? What was the root cause of the problem that you then tried to solve with your action plan?
We identify some of them to be large immunization sessions. Some were having larger numbers in session, which usually cause inconvenience. So I intend to reduce the waiting time. And we realize that some of the community health workers find it difficult to keep track of their uh, 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 defaulted tracing. So we intend to develop an e-tracker, electronic tracker, whereby even if the mother delivered at the facility, the child name will be entered and it will be monitoring when the child is due to remind the caregivers and then to try to plan immunization sessions with caregivers to always decide who day is convenient for them.
All right. And so now tell us about the corrective actions that you've taken over the past year. What have you done and what difference has it made? How has it turned out?
So far, we have actually been able to reduce the larger numbers of immunization sessions. Some were having as high as 100 attendance per session. So we are able to reduce some to 30, a minimum of 30 per session, and that has increased our immunization outreach sessions and then static services. We've been able to develop the e-tracker. That was even 2021, but some facilities were not able to utilize this, but were able to put it into practice. And it has helped a lot in identifying and then keeping track of defaulters. So if the child is due, then some days the child will be due, it will highlight green, and then the CHO will start keep tracking of those children. So before the CHO even gets to the outreach session or they prepare for the static, the community health officer already know the number of children he or she expect and they know the number of vaccines to carry along. We've been able to organize some form of WhatsApp group among caregivers. So those who are electronically inclined, they join these platforms and then their weighing sessions, immunization sessions are being communicated through the WhatsApp platforms for them to keep reminding their colleagues of when to attend weighing sessions. So far, we've been able to have an engagement with stakeholders, organize some good number of community debates to sensitize mothers about the importance of immunization, and now to extend immunization coverages, immunization sessions to some schools, the KGs, under 5, so that children who are due and probably the mother was not able to pick them to the outreach session or the static, the CHOs, the community health officers goes there to immunize these children during the school sessions.
Understood. Thank you for sharing this implementation story, Castro Fogambong. My next question for you is, so you participated in the full learning cycle between March and June 2022. You engaged in many different peer learning activities, shared experience with your colleagues, they shared experience with you. What difference did it make? How was it actually helpful to you? That's what we'd like to know.
It has actually been helpful to me. I've learned from a colleague, and that is, if you really want people to accept the package, immunization package you have, then you have to plan the sessions with them. So I've realized, and I've introduced this in most of the communities. Some of them, usually they decide when they will be available to organize the immunization sessions. But when I've introduced this one, caregivers got to understand, and then some of them really appreciate that sometimes they wish that immunization sessions should not be organized during their market days or when they have funerals, because they will not have time to attend to them. So it actually helps me to keep track and have confidence that bit by bit we will achieve our target, and every child, and then on the immunized children will be reached.
Thank you very much indeed, Castro Fogambong from Ghana. One more implementation story, and remember, there were more than 1,000 action plans developed in May 2022 in a period of just 2 weeks, and we've asked leaders of the movement to share what we call an acceleration report, so we can get the updates and understand what are you doing with these action plans. Some of you may have stopped, some of you may have been successful in implementing them. In that case, we want to hear the story of that as well. And as I said, we've published several stories, including those from Westam Faye from Senegal, Frank Manga from the DRC, Maria Fernanda Manzan, but we will not stop until we have 1,000 action plans. And for those of you who are new to the movement, who have not joined yet this movement for Immunization Agenda 2030, the world's strategy adopted unanimously at the World Health Assembly in 2020. You're going to receive the invitation as a Teach to Reach participant to join this movement and also develop your own IA 2030 action plan. Begin thinking through that process from learning to action to results, ultimately to impact.